Early in 2002, the first two members of Assist International arrived in Kabul, Afghanistan to begin a series of partnership ventures with Rotary International to bring supplies as well as food and tons of medical equipment and even an ambulance to Afghanistan donated directly through the Kabul Rotary Club. Many improvements have taken place in Afghanistan in the recent years, but much work remains to be done, especially in the areas of public health. Therefore, this hospital in Kabul received a fantastic intensive care unit under the administration of Carl Stunkel and Bob Paget. These partners, along with the Hayward, Sunset, and Oakland Rotary Clubs and the Washington Hospital and the Rotary Club of Kabul, were able to accomplish this project. These inspired partners now propose a new project. Here, at the public hospital in Jalalabad, Afghanistan. Jalalabad is located in the Nangarhar province of eastern Afghanistan, near the Khyber Pass and the border to Pakistan. This hospital is the largest hospital in this region and serves not only the community of Jalalabad but the surrounding province as well. While some of the concerns in this region are unique, this hospital provides an excellent level of care, especially in general surgery, where the operating theaters are managed by the International Committee of the Red Cross. There are a number of operating theaters, and every type of surgery can be expected, although the technical support is quite modest, as we see here by the only cardiac monitor in the surgical center. And although the surgical center is modest, it's the post-surgical care that is the most critical need for the patients in this hospital. The intensive care unit and cardiac care units present the largest need in the hospital. The head of this section of the hospital is Dr. Amal, seen here on the left, who is quite capable but has absolutely no cardiac monitoring equipment to assist him. As we enter the corridor, the women's ward is on the right and the men's ward is on the left. Most rooms accommodate 2 patients each. Some rooms will only accommodate 1, and at the end of the corridor is the proposed location for the central station for this intensive care unit. Now, moving away from the area for the proposed central station, we'll examine the patient rooms and see what the need actually is. Here we find a very clean double patient room, but with absolutely no medical equipment to support. We propose to install cardiac monitors in these rooms, where they're marked on the bracing between the windows near each bed, one on the left and one on the right. And with this closer perspective, we can see marked on the wall exactly where the monitor mounting brackets can be fixed to the walls. Now, proceeding to the next room down the hall, we find a single bed that may be more appropriate for a roll stand monitor, although the fixed monitor here will work as well. Moving to the opposite side of the corridor is the women's ward. Here in this room we discover 2 women that are very sick, being cared for in the intensive care unit. Again, no cardiac care monitoring equipment. The proposal is to install, as in the men's ward across the hall, 2 cardiac monitors to be mounted on the bracing between the windows to care for these patients. Here now we move to the next room of the women's ward, and we discover the room fully occupied, 2 women very sick, and we see the only medical equipment that is provided, a blood pressure cuff mounted on the wall. Again, no cardiac monitoring, no monitoring of blood pressure, of pulse, of respiration, or pulse oximetry, no support at all for these patients. It could be installed here. If needed, roll stands could work as well. This is the proposal. Here now, as we enter the last room of the intensive care unit, we are again confronted with the harsh reality that not one patient room has 1 cardiac monitor to care for these patients. And while this gentleman offers the traditional Afghan greeting, he represents all of the patients in this hospital and in this region that need our help. Here in the neonatal intensive care unit of the hospital are incubators to help care for the infants, but there is absolutely no cardiac monitoring equipment. Although there is adequate electrical service on each wall and in every area of this ward, no cardiac monitoring equipment exists whatsoever. This is particularly significant because Afghanistan has the highest infant mortality rate of any country in the entire world. And even while we were here, the nurses were struggling to help a baby that died right in this crib. There had been no monitoring equipment to sound an alarm to help them to do their job. This equipment is desperately needed. This ward now is for medical and surgical patients that are recovering. In this ward there are 12 beds. There is a men's ward and an identical women's ward on the opposite corridor. You can see the black cords, white plugs. There is electrical service in some areas of this ward. However, just as in the intensive care unit, there is absolutely no monitoring equipment, not even the most rudimentary monitoring equipment to care for these patients. Here in Afghanistan, there are still many challenges, but the future can also be very bright when friends will partner together for a worthy project such as this at the Jalalabad Public Hospital.